How can we improve functional outcomes after total knee replacement? Although total knee replacement is among the most successful surgical treatments, up to 20% of all patients are not satisfied with their functionality of their artificial joint. A reason for that might be an overcorrection of the natural knee axis or an implant system that works against the natural kinematics of the patient. To optimize the implant positioning and choose the right implant design, new simulation models are developed and validated in a collaboration with the ETH and Aesculap.
Over the last 7 or 8 years here at ETH Zurich, we've created a unique technology that is able to capture the movement of the bones inside the body throughout complete cycles of daily activities. Together with advanced computational and numerical techniques, we're able to model the position and then the loading conditions of the bones in the knee and convert them into simulation models that are able to predict the functional outcomes of implants after surgery.
The first simulation model was already implemented into the surgical navigation system, allowing the surgeon to place implants in a safe corridor. Next step is the integration of the post-operative kinematic outcome by using musculoskeletal modeling and machine learning.
Future implementations of this technology will allow us to use machine learning models to improve the predictions, but also use the predictions real-time intraoperatively or during surgery so that we can improve the post-operative outcomes for patients in real-world conditions.